Om Swastiastu. Good afternoon, Doctor. We are from Small Group Discussions B5. In this opportunity, we will presentate about acute rheumatic fever as student project in infection and infectious disease block. The members of our small group discussions is shown on the screen. The presentations will be continued by my partner.
Acute rheumatic fever results from an autoimmune reaction caused by group A streptococcus or gas infection. This bacteria usually cause pharyngitis, however, untreated condition could lead to ARF and eventually rheumatic heart disease. An increase of 70.49% in ARF incidence number was shown from 1990 to 2019. About 60% of its incidence developed into rheumatic heart disease. This condition commonly happened in children, especially people who had health facilities and services out of their reach. Rheumatic heart disease itself will result in permanent heart damage, thus requiring surgical treatments, which is high in cost. Knowing that it can be prevented, it is important for us to further understand this condition, its effect when it is left untreated, and its management.
Good afternoon, my name is Philbert Purbowo and the last few digits of my name is 148. The research problems discussed in this literature include what is acute rheumatic fever, what are the characteristics of acute rheumatic fever, and how to manage acute rheumatic fever. The objectives of this literature include understanding the definition of acute rheumatic fever, identifying the characteristics of acute rheumatic fever, and understanding the management of acute rheumatic fever. As for the research significance, this research hopes to allow a better understanding of acute rheumatic fever to help in the identification and management of acute rheumatic fever, as well as providing knowledge regarding the disease which can be used for further research. That's all from me. Thank you.
My name is Putu with my last digit of ID number being 185. So acute rheumatic fever is a condition which arises due to the body's immunological reaction to a throat infection brought on by Streptococcus pyogenes, also known as the group A Streptococcus bacteria. Since 1944, the Jones criteria, which have been continuously updated, have been used for RF diagnosis. The 2015 update of the Jones criteria emphasizes how crucial it is to be aware of the epidemiological situation of RF in one's local area.
Hello, my name is Ananda Aulia with 3 last digits of my student ID number is 015. Now I'll present you about the epidemiology of acute rheumatic fever. The global occurrence of acute rheumatic fever ranges from 8 to 51 instances per 100,000 individuals, with the most elevated rates occurring among children aged 5 to 15 years old, and there is no significant gender correlation in this condition. That's all from me, thank you. Next slide, please.
A previous group A streptococcal pharyngeal infection might cause acute rheumatic fever. An article stated that this inflammatory response is more commonly linked to pharyngitis than skin infections, but some data indicate that skin infections, particularly impetigo, may play a role for high-risk communities like the indigenous Australians.
There are some risk factors of acute rheumatic fevers. The first one is preceding group A streptococcal infections. It was found that half to two-thirds of group A streptococcal pharyngitis cases lead to acute rheumatic fever, with a 21 days latent periods of group A streptococcal pharyngitis before the onset of acute rheumatic fever symptoms. Group A streptococcal skin infections or impetigo can also initiate the autoimmune process as explained in the previous slide. The second one is environmental risk factors. As group A streptococcal pharyngitis can easily spread via saliva and nasal droplet transmissions, a large social network and cramped living conditions such as household crowding is a coherent risk factor. This is supported by a study in New Zealand reporting that 58% of participants experiencing a bedroom deficit of one or more, including 35% of them experiencing severe crowding. Apart from that, poor housing conditions could also support the transmission of group A streptococcal, as a pilot study reported that 78 to 80% of acute rheumatic fevers cases revealed that the patients were exposed in the 12 months preceding their acute rheumatic fever diagnosis to a poor housing conditions. The third one is education, health, and nutrition factors. It was found that lack of health awareness, especially with the low education level of the mother, as revealed in the Yugoslavian case control study, was associated with acute rheumatic fever. A number of studies also discover a link between dental caries with acute rheumatic fevers. Children with 5 or more primary teeth affected by caries were 57% more likely to develop acute rheumatic fever compared with those who doesn't. Several aspects of nutrition partake in a possible contribution to acute rheumatic fever risk. A study in Bangladesh observed an association between acute rheumatic fever with reduced albumin and iron stores along with low consumption of certain foods, especially egg. And the last one is genetic factors. Significant association between variety of genetic polymorphism, as written in this slide, and acute rheumatic fever have been found. In various populations, several human leukocyte antigen class II correlation with acute rheumatic fever have been noted. Given that acute rheumatic fever shares an autoimmune etiology with rheumatoid arthritis, it is conceivable that human leukocyte antigen class II gene environmental interaction might exist and contribute to the disparity in acute rheumatic fever occurrence.
Thank you for the opportunity. Next, I will continue the presentations by presenting the pathogenesis of acute rheumatic fever. The pathogenesis of acute rheumatic fever is an autoimmune response to group A hemolytic Streptococcus B infections in the throat. Major histocompatibility antigens, potential tissue-specific antigens, and antibodies that develop soon after streptococcal infections are some potential risk factors in the pathogenesis. T lymphocyte cells play a role in the pathogenesis, and turns out type M of group A streptococcus has rheumatic potentials. Besides that, autoimmune response to streptococcal antigen play a role in the development of rheumatic fever in susceptible individuals. These include 0.3 until 3% of the populations. Next, the presentations will be continued by my partner. Thank you.
For the clinical characteristics of acute rheumatic fever, they result from antibodies initially formed against the group A Streptococcus bacterium, and later against the myocardium, joints, basal ganglia, and also the skin. For the symptoms, they are the major and also the minor symptoms. For the major symptom, there are arthritis, carditis, chorea, and skin manifestations like erythema marginatum, also subcutaneous nodules. For the minor symptoms, there are joint pain, fever, polyarthralgia, elevated acute phase markers, and also prolonged PR intervals based on age and heart rate.
Alright, let me introduce myself. My name is Justin Keane Adhinata Santosa, with the last 3 digits of my student number being 106. And now I'll be explaining about the diagnostic criteria of acute rheumatic fever. So, acute rheumatic fever has no such one gold standard lab test, and thus the diagnosis of ARF, or acute rheumatic fever, needs to be made clinically. So, the tool or the criteria used for the clinical diagnosis of ARF is called the Jones criteria. This was first published by Dr. Jones and was revised in the year 2015. So the Jones criteria takes into consideration major symptoms, minor symptoms, and also the risk level. So in order for a positive diagnosis of ARF, there must be either one of two major symptoms, one major and two minor symptoms, or three minor symptoms. So once all these criteria are fulfilled, then we can say for certain that someone or a person is suffering from acute rheumatic fever. So that'll be all for the diagnostic criteria of ARF. Thank you for your time.
Thank you, Doctor and the moderator. Firstly, let me introduce myself. My name is Komang Chandra Yogananda with last three-digit number is 091. So in this section, I will explain about the complication of acute rheumatic fever. So the acute rheumatic fever is a condition that can lead to a range of serious complications. Firstly, it can lead to rheumatic heart disease, damaging heart valves and potentially causing heart failure. The secondly is it can affect multiple organ systems causing joint inflammation, skin rash, and neurological issues. So early intervention and improved healthcare access are crucial to reduce this related complication. That's all from me. Thank you.
Hello everyone, let me introduce myself. First, my name is Komang and with the last digit number of 24. And now I will explain about the management of acute rheumatic fever and prognosis acute rheumatic fever. First, the management of acute rheumatic fever involves from treatment, long-term management, and effort to limit the extent of epidemic. Antibiotic therapy. Antibiotic therapy is the constant of ARF management. Penicillin is the preferred antibiotic for the treatment of streptococcal pharyngitis and the prevention of recurrent ARF. Anti-inflammation of therapy. Anti-inflammation of therapy is used to reduce inflammation and prevent further damage to the heart. Aspirin is the preferred anti-inflammation again to the treatment or ARF. Long-term management. AR requires long-term management to prevent recurrence and minimize the risk of complication. This may include the use of penicillin and sulfanilimide for prevention of liquidations. Patient education. Patient education is an important component of ARF management. Patients and their families should be educated about the importance of completing the full course and antibiotics, the sign and symptom of RRF and RRHD, and the need for regular follow-up visit. And now I will explain about the prognosis. The prognosis of acute rheumatic fever can vary depending on various factors, including the severity on the initial episode, the presence of carditis, the promptness of diagnosis and treatment, and the individual patient response to the therapy. Heart involvement and complication. ARF can lead to carditis, which is inflammation of the heart and can affect the heart valve. The severity of carditis and the extent of valve damage can impact the long-term prognosis. Resolution of symptoms. With appropriate treatment, the symptoms of RV such as fever, joint pain, and inflammation can resolve. Recurrence. Recurrence of RRF is a concern as it can lead to further damage to the heart valve and an increased risk of developing rheumatic heart disease. Subclinical myocardial involvement. Some patients with RRF may have subclinical myocardial involvement, which can be detected through plasma and terminal probrain natriuretic peptide assessment. Elephant level of NT-proBNP may indicate subclinical carditis and pulmonary prognosis.
Thank you for the time. My name is Nathanael from Monika with real life digit number 077. I'm going to talk about the conclusion. So, acute rheumatic fever (ARF) is a condition triggered by the body's immune response to a acute infection caused by Streptococcus pyogenes, commonly affecting children aged 5 to 15. Various factors, including previous streptococcus infection, environmental, educational, health, and genetic factors, contribute to the risk of ARF. Major symptoms include arthritis, heart inflammation or carditis, chorea, and skin manifestations like erythema marginatum and subcutaneous nodules. Immune system encompasses joint pain, fever, joint inflammation, and elevated markers of inflammation. Treatment involves antibiotics, anti-inflammatory drugs, and patient education. Thank you for the time.
Okay, that's all from our SGD. Thank you.